Welcome back. A substance abuse campaign aimed at raising awareness about the harmful effects of alcohol use has been unveiled by the Substance Abuse Unit of the Department of Health and Wellness. More in this report.
The Substance Abuse Unit is working closely with the Traffic Unit of the Royal St Lucia Police Force to educate St. Lucians on the impact of alcohol on the family, community, schools, workplace, healthcare system, and society as a whole. Program Officer in the Substance Abuse Unit, Nadia Smith, says it is important that St. Lucians are aware of the dangers and health effects of alcohol consumption.
As we know, alcohol use is part of our culture, religious and social practices right here in St. Lucia, and it provides some level of perceived pleasure to many users. This campaign has been designed to show the other side of alcohol, to show the harmful effects it can cause, the diseases it triggers, because I'm not sure how many people out here know that alcohol consumption is a risk factor in 25 chronic diseases.
Smith also emphasized on the need to educate St. Lucians about the risks associated with alcohol use, such as domestic violence and traffic incidents.
I really find that during Carnival and Christmas, New Year's, persons allow the children, teenagers, to go ahead, have some fun with your friends, go out, and they tend to consume alcohol during that time. We also have a problem with adults who go out to parties. They drink and then they drive. They get behind that steering. This is why we brought the traffic department on board to speak to us. We have a lot of intentional injuries where persons consume alcohol, and when they go back home they get themselves in domestic violence issues. So those are the things that we really want to speak to persons about. We think it's vital that they get the information, because with information they are now better able to make informed decisions.
The substance abuse campaign will run from December 3rd to the 14th and will entail multifaceted communication strategies comprising television and radio talk shows and discussions at health clinics. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fennel Neptune.
A 3-day technical assistance proposal writing workshop got underway on island. The workshop is being organized by the Department of Commerce with funding from the Caribbean Development Bank. One of the participating organizations is the Cultural Development Foundation, which says that workshops like these are critical to the organization.
The CDF is funded by central government. However, because of the scarcity of resources, we are not comfortably able to execute the mandate of the CDF, and the two officers from the CDF who are attending this workshop are of the view that the technical support that we will receive here over the 3 days will assist us in crafting proposals that would allow the CDF to seek external funding from agencies that are out there, because we know there are monies out there, but it's to ensure that you craft your proposals in such a way that would allow you the opportunity to be able to source those funds.
That was Ramona Henry Wynn of the Cultural Development Foundation. In other news, the Department of Health and Wellness is being commended by Queen Elizabeth Diamond Jubilee Trust for its progress in tackling blindness caused by diabetes. More in this report.
The Queen Elizabeth Diamond Jubilee Trust is a charitable foundation established in 2012 to mark and celebrate Her Majesty the Queen's 60-year contribution to the Commonwealth. Chief Executive of the Trust, Dr. Astrid Bonfield, paid a visit to St. Lucia recently, where she met with health officials and representatives to reflect on work undertaken to increase public awareness about diabetic retinopathy.
Well, it's all been about linking through our partner, the London School of Hygiene and Tropical Medicine, health professionals here in St Lucia, being linked up with health professionals in the UK. Teams have travelled backwards and forwards, so we could learn from what happens in St Lucia, and the UK team could do some training here. So a lot of the work has been about training staff, and it's also been about providing some equipment for St Lucia so that you can have the right treatment for people who have diabetic eye disease.
Medical Officer of Health, Dr. Sharon Belma George, expressed gratitude to the Trust for its support in championing the issue of diabetic retinopathy in St Lucia.
One of the core functions of the Trust is to prevent avoidable blindness in developing countries. So they have been working with us from 2017, from early 2017 on the implementation of this program. And we have launched from February of this year the full program implemented into our primary care system in a sustainable manner. And we have been able to provide the service of eye screening, eye grading, and also laser surgery free of charge to our diabetic patients here in St. Lucia.
The Queen Elizabeth Diamond Jubilee Trust has provided equipment and trained healthcare professionals in eye screening treatment for people with diabetes. During her visit, Dr. Bonville also met with the Queen's young leaders who have been making a positive change in the communities. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fernal Neptune.
As the Department of Health and Wellness seeks to create safer, greener, and more sustainable health facilities, a number of wellness centers will be closed to facilitate retrofitting works under the Smart Health Facilities project. The works will help the facilities to become more energy efficient, environmentally friendly, and better able to adapt to the effects of climate change. These changes will take effect from the 10th of December 2018.
As a result, health facilities will be redirected as follows. Viewfort Wellness Center will be relocated to a building on Clark Street opposite the Ideal Bakery, which is at the corner of the Clark Street and Luther King Street. Residents from Lafargue and Morgouge can access services either at Etan's Wellness Center or Soufrière Hospital. Residents from Saltibus can access services at the Labrie Wellness Center or Viewfort Wellness Center. And residents from Bexar can access services at Cicero, Vanna, or Castries Wellness Center. Clients are also free to access services at any other wellness center during this time. Outreach, health clinics, and home visiting will continue in the various communities. Viewfort Wellness Center will undergo full retrofit and will be closed for approximately 6 months. Saltibus, Lafargue, Morgouge, and Bexar will be undergoing small SMART interventions and therefore will be closed for approximately 3 months.
The Department of Health and Wellness is seeking the support of the general public, especially those from the communities that are affected during this time. The department apologizes for any inconvenience caused as a result of the changes. You're watching the Hot 7 Nightly News. Up next, Sports News with Tennyson Glasgow.